Good afternoon. This panel is going to be full in English because we have two panelists from non-Serbian speaking, and one of them is here and one of them will be online joining us. I'm very happy that this year as well, the same as last year, the last panel on the Kopaonik Business Forum is dedicated to healthcare. And as I said last year on this panel, the government of Serbia does see the healthcare and everything that's happening around healthcare as a huge opportunity both for the benefit of Serbian citizens and improvement of our healthcare system through digitalization, through new science, through new methods of diagnostics and treatments, new protocols, new knowledge, artificial intelligence, etc. And also as a huge economic opportunity. So I'm happy that this year, today, we are going to dig a bit deeper than last year, and we are going to talk specifically about the role of life sciences in the healthcare. Together with me, I have here Mr. Branko Radulović, professor on the law faculty of University of Belgrade, Mr. Nick Guldemond, also professor, and Mr. Adriano Treve. He has a long function. He's area head, Turkey, Russia, Iran, Central Asia, Caucasus, Eastern Europe, and Indian subcontinent, the Roche company. So welcome to this panel. It is my pleasure to be together with you today. And since I presume viewers of this panel are mostly businessmen, and when we say life science in healthcare, most of us, I presume, are not very familiar with that. So I would really try to ask and start with Mr. Branko Radulović to tell us about what is life sciences in healthcare. What does that include? What does that mean? And also you have in materials that we received here in the forum, there is a great publication about precision medicine. So please tell us a bit more what's in it and try to inspire people to read it when it's available online as well.
Well, it's quite wide area of how actually you can improve healthcare systems and how to use the recent knowledge and most advanced technique in order to provide a better treatment for patients and better outcomes for patients. So for the purpose of this event, we actually prepared a policy brief or policy document that elaborates opportunities and challenges of how to integrate this life science or personalized medicine approach into Serbian health system. And we try to see actually what are the opportunities, what are the benefits both for patients and for socioeconomic benefits in general, and also to see what are the key challenges both in regulatory terms and how to finance, how to propose adequate payment models that would actually enable integration of life science approach of personalized medicine into Serbian healthcare system. And we also try to see, and I hope I will elaborate this a bit more after this first round of questions, how basically we can see what are the basic building blocks, what Serbia should do in order to implement this effectively into the current system. There are pros and cons. This should be obviously fiscally sustainable solution, but also it really provides major benefits for patients. And probably when I was started to think about this, together with a colleague of mine, Professor Popovic, who is co-author of this policy paper, he's professor of competition law and intellectual property law, and these are all related fields, and I'm an economist, so we are obviously not medical doctors who can discuss into details technical issues. It's far from our knowledge, but we can see and provide this policy perspective and see how other countries try to integrate this into their healthcare system. So on the one side, Serbia is actually much better doing than we have prejudices and biases. And we most often probably hear a ranking that was cited was Doing Business ranking or World Economic Forum ranking. But there is also European Consumer Health Index ranking. And actually Serbia is ranked 18th out of 35 countries there. European countries. So this is, for me, it was kind of surprise. Maybe it's because of inheritance of our system, because of some other issues. But basically, when you talk about the coverage, when you talk about the generosity of system, our system is not that bad. And I think that citizens realized that during this pandemic, actually, that our system was more resilient than some others. And what, on the other side, we can see is basically some figures that are related to outcomes in mortality rates in cancer, in heart disease. These are not really good. So there is a really vast opportunities, and we should really figure out how this complete change of paradigm in health can be used in Serbia in order to really improve our healthcare system in near future and mid-term period.
Okay, Nick, you are also the author of Building Blocks in Personalized Healthcare. So can you please tell us a bit more about those building blocks, which they are, and how far in the future is this new paradigm shift that Branko just mentioned?
Yes, thank you very much. It's a great pleasure to be here. And I also want to congratulate my colleague with writing this policy paper. I think it's quite concise but comprehensive, describing the various elements which are needed in order to make the sort of environment, the ecosystem, how to make it work. And there's exactly the sort of challenge. Because of the complexity, you have all kind of elements you need in it. That's the technology, it's the service provision to patients and people. It's about the finances, how the people are organized. And that across different sectors and stakeholders. And this complexity makes it often very difficult for governments, for regions, localities, in order to make it work. So therefore, I think it's good that there's a good paper to start from and to look how does the Serbian ecosystem might work. And what do we need to make the transition into a better personalized medicine and an overall improvement of the healthcare system. So an understanding of the ingredients that's a good start. And then is how to translate this in a sort of change in the environment and aligning the different stakeholders. Roughly, if you look around the world, there are many ecosystems and innovation settings, startup initiatives on personalized medicine, on digital health, etc. But if you really looking close to their performance, it's actually how the different elements work well together. And I think there's the key, but I think also very much the opportunity for Serbia, because a lot of things are already there and are linked, and there's a sort of shared ambition, which makes that it could make a difference and very attractive also for students, for companies, in order to make it work.
Okay, Adriano, you worked in more than 20 countries, and so what are some of the key success factors to get to this paradigm shift state that we believe is very important to transition?
Yes, indeed. And first of all, thank you very much for the invitation in person. And but I hope that next time this is possible. From my point, what I have seen, and having worked in many countries, the basic thing is building trust between, the people that you're working with, which means your stakeholders. So the trust that you have with the people in the government, the people that work in the healthcare sector, the researchers, and I think this is the key ingredient to make sure that we can make and bring innovation to a country, collaborate on projects that are a benefit for everyone. So it's not the technical question; it's more a matter of trusting each other, moving things forward, and it's like in a relationship. Sometimes you have some up and downs, but I think if the relationship is good, you can do amazing things.
Thank you. Nick, you also work throughout the world. What are some of the best practices and what countries would you say are doing this well, and maybe which ones, if you would like to share, are not doing this well? So maybe to avoid some mistakes that people have made in the past.
Yes, I think that's an important question because there are many initiatives to make clusters, innovation clusters, focusing on health and digital to make it work. But there's also a lot of marketing, also from the well-known names in this area. Yeah, some of them are really successful, but only for research and development, or more on the startup businesses. Or high specialized providing care. But still, it's quite rare that such a sort of ecosystem is supporting healthcare overall. And being successful overall in healthcare, that means also to provide better care for people in communities, not only medical, but also in prevention and health, even social aspects. This really integrated approach, which is very much also promoted by WHO, OECD, European Commission, on what we should do to improve better health for societies and economic resilience. So usually it's much broader, and the interconnection between research and development, education, startup businesses, attracting money and talents, and connecting this also with the people, the communities, for improvement of health, this is yet to be established. If you look to all the clusters in the Netherlands, in Europe, Sweden, Lausanne, Heidelberg, etc., all the cluster, they're still struggling with translating this to the benefit for people from a health impact perspective. What I think typically is more interesting is, for example, how Romania is working along these lines on building a cluster and innovation. Same as for Poland, Wrocław, Gdańsk, Skolkovo in Russia, and Tatarstan with Kazan. Still, all they have their shared ambition, they have their different strengths and weaknesses, but they working in a sort of different way as which has been promoted in, for example, the IT sector in Silicon Valley. And healthcare is a very different sector if you compare to others, and I think Branko can also elaborate on this. So I think, yes, we have good examples, and the best what Serbia can do is to look to those examples, extract the lessons, and translate it to the Serbian context, and do it in a Serbian way. That's the only thing that can work, and I think there are some unique assets, like the IT integrated information system, which is, yeah, very quite unique, actually, if you look across the world in healthcare. So there are elements which also create the opportunity, which are different, and which you can also build on making it more attractive for students, etc. And maybe one thing to add is, if you're looking for companies like Roche or medtech companies or health IT companies, they're typically also looking for these unique clusters where they have all these things integrated. It can be on specific issues, but ideally from this perspective of the patient and the patient needs. So I think that would be really, I think, the thing to go for.
I noticed that all the examples that you mentioned are basically East European. Is that a coincidence, or what's happening there?
Oh, well, no, I just mentioned them also because I was recently in contact with them. No, I also work in Brazil and in China, for example. And of course, these are a bit different settings. But basically, they're struggling with the same sort of issues. Usually, these clusters or the healthcare system is very fragmented. So in order to build a sort of innovation cluster which is fully integrated is often a challenge. So I think in this integration, this joint approach, joint vision, and it's very, I think, encouraging to see that from a governmental level to academic point of view, patient organization, everybody seems to be aligned with this idea. And I think that's a wonderful starting point.
Thank you. Adriano, I have to ask you the same question. Are there any best practices that you would like to emphasize?
Yeah, I mean, I think perhaps on a country level, there are, let's say, islands of good practices where I think things are moving in the right direction. I must say that in my whole region, I must say that Serbia is really perhaps one of the countries that is most advanced in all of this, in particular with the idea of this digitalization. And I must say that I'm impressed what you are doing. And of course, this is very interesting, and I'm sure that at the end, when all the stakeholders work together, that the patients will get a benefit out of it. In other countries, I think there, as I said, there are some islands, in different therapeutic areas, in how to treat cancer or how to treat other diseases. But in general, I must say that, as Nick Goldemond said, the systems are pretty fragmented everywhere. If you look in Brazil, for example, and as Nick mentioned, he has worked in Brazil and he knows it, it's really fragmented. If you go from north to south, it's like different countries, and they have different approaches. But still, in some of the areas where people really work together, they can make a difference. And this comes back to what I said at the beginning. If you find a group of people that really want to move something, they can do it. But again, it's not an easy thing because the systems have been working for so long in the same way, with the same bureaucracy, with all the interactions that are playing out, that sometimes do not really help the patient at the end. And I think I would say that again, big jobs need to be done in trusting each other, working together with each other, moving the things forward. It's the same idea actually at the end to help the patients to get a better treatment. And I think if I look at the governments, some governments are really open, are really ready and proactive. Some governments are a little bit more reluctant because, when we talk about data, because data, for example, is something very important. And I think what you're doing in Serbia, building this huge supercomputer with all the data, that's an amazing tool, to start analyzing, this data and come up with solutions that at the end will help, the patients to do a better job, and to use also this data for the patients so that they can access their data and do a better job and a better, how shall I say, a better analysis of their own, life that they have, and perhaps do some adjustment to their life so that they have, perhaps a better and longer life, so that we help them to do some preventive work with data that we can supply them. So it's I wouldn't single out one country because, as I said, there are so many different islands of good things that are being done from. I've seen hospitals in India that have a fantastic infrastructure to treat patients. However, if you read the news about, for example, the whole pandemic, then you think that India is collapsing, and of course they had a tough or are having a tough time. But still, in all these difficult environments, there are islands, of hospital or hospital chains. That have really a very good, let's say, infrastructure to support patients. But of course, in countries where you have, like in India, over 1 billion people, or in Pakistan with 200 million people, if you have a small island with, a couple of hundreds of doctors, for them it's very difficult to handle all these issues.
Thank you, and thank you, especially thank you about your kind words about Serbia. And Branko, data digitalization keeps popping up, and how, as I believe you're familiar with the situation in Serbia, so how can Serbia, use data better? What should we do? How can we use digitalization and data in order to get to this new paradigm?
Well, there are actually right now a number of initiatives that are taking place in Serbia. So I think there is a drafting group that are developing a national program for e-health development. So this is one step. And actually, why this is popping up? Because it's a precondition. So you really need to have functional health e-records in order to have this system fully functional. There are also other preconditions, but we already have a lot of things in place. One thing, for example, we already adopted in our regulatory framework managed entry agreements, which are something that is used in order to provide personalized medicine. Of course, we should now expand, look at the specific areas where this can be implemented, and also there are a number of other countries that are mentioned here, for example, Denmark, UK, more advanced countries that we can also look at because they already have some kind of public policy documents that are aimed to develop this specific sector. So there are a number of information that we can use in order to both develop IT as a precondition, but also other regulatory framework, especially that would enable development of this kind of health services. Also, we should think about maybe conventional payment options, these various ways. This is for economists one wonderful field of research because these are contracts and agreements that should provide most efficient outcomes. So we are talking about value caps, volume caps, risk-sharing agreements. There are various things that we can right now implement in Serbia, and some of these things are already implemented. But then we should not only focus on IT, this is a precondition, but also talk about specific regulatory impediments. Maybe we can think about off-label use and try to relax the current system that would enable spreading this type of services much more efficiently in Serbia. And finally, there are other initiatives. We need also to think how to finance all this. The imperative is to have fiscally sustainable solution. In a great book published by NALED on health issues, there was a recent proposal to establish a specific fund that would finance all these types of initiatives. So this is maybe a valuable proposal that we should think of, and especially those that are decision makers should think about this.
So basically, with implementation of precision medicine, should the healthcare system cost more or less than it costs today?
It should cost less, but it should always be cost effective. You know, you should not think that it's a solution that's like a panacea that can cure all the things. It's far from that. Actually, it's as our colleagues mentioned, it's a scattered approach that's not quite often used. You should create a favorable ecosystem, but also you should always be aware that eventually this should be cost effective, so that the outcome for the patients, the benefits for the system, cost savings should be such that should be justified. And it's not something that you can just go ahead with and think about this goal in a midterm, let's say 10 years from now, that it will be always positive. No, you should always think about the cost effectiveness of this proposal.
Thank you. Nick, what's your take on the financing of all those innovations in precision medicine? And is it going to extract more money from citizens for healthcare, or is it going to save money? And what's happening throughout the world in other countries?
Well, I think in general the tendency from governments and healthcare spending is the models which are more based on performance and outcome-based financing models rather than fee-for-service is currently more in focus because it's better to pay for a better outcome rather than just a single intervention. It follows also the logic that you look at the total process of care. So, of course, healthcare is proven not only about providing medication, doing the right diagnosis or the treatment. Usually it's a whole process which also includes the prevention part, rehabilitation, follow-up, monitoring, but also other aspects, social, mental health aspects. If we look to, for example, breast cancer, it's not only about the breast cancer itself, but usually it has all kind of other elements, including returning to work and quality of life. So, and thinking about improvement, the improvement is within the process. So, pay for performance is the way how to incentivize the system in order to align. I should say that there's a lot of focus on value-based, what they call value-based healthcare, and these outcome indicators. I think what's a bit overlooked or underestimated is the process needed in order to come to this quality. And this is, I think, also a main challenge for healthcare in general, how to integrate the services in order that from a patient perspective, the patient needs are leading in the type of services provided. And that applies to very general problems, but also in personalized medicine, like breast cancer, lung cancer, etc., or rare diseases. And therefore, it's also the patient is so important in this, or the people of Serbia. It's eventually their needs and expectations, which should be taken into account. How can we improve things? So I think that should be a sort of leading principle into thinking in implementation and improving of the system. And for this, and I agree fully with what Adriano said, trust between all the actors is key. Because you need a total, or in most systems, a total way of how people collaborate with each other. Also for professionals, among each other, among different institutes, from hospital to primary care, social care, community care. So it's doable. And I think also with, this vision and this ambition of the government, I think it could work. And it would be wonderful if this could be a reality in Serbia.
Thank you. And talking about value-based healthcare and comparing outcomes and paying per outcomes, one of the major questions that I've encountered at least is how to factor in the behavioral changes that occur when people know that there is this value-based healthcare system.
And you mean from a patient or professional side?
Both,
or both?
Yeah. Both sides, yes.
Well, I think it comes partly also, it's a multi-level story, because you have to tell the community, all the actors, okay, this is the direction we want to go, so that everybody, okay, this is going on. And of course, then you have the different target groups, like professionals in the hospital, primary care, social care. Okay, we expect, or we would like you to invite to think about how this could work. And to start a discussion, usually the story of the patient is a very good start. Because the patient is telling a story which is related, of course, to the healthcare provided, but often very different from what doctors think among each other. And so if they're discussing better diagnostics, the doctor knows, okay, I want this equipment, I want this type of data. But usually the patient is telling a different story. Like, I'm frightened, I'm insecure about waiting times on diagnosis, etc. So it's similar and related, but it might think stakeholders to think differently. How can we improve maybe the sort of process and information rather than just install new equipment or whatever?
Thank you. Adriano, I have a super important question for you because you emphasize this trust among all the stakeholders. So there are many stakeholders now. There are IT guys, there are AI guys, there are biology people, genetic people. They're all entering into a field that was traditionally kind of reserved for pharmacists and medical doctors. So how to engage the healthcare system to open up for those new solutions, new business models, new contracts, new everything, digitalization, data, everything. I mean, so many things are changing in their lives so quickly. So how can they get on board with all others?
Yeah, that's a very important question. And let me perhaps take it a little bit, or making it a little bit bigger. I think, bottom line, in my view at least, the physicians they are the ones that are in touch with the patient. So they need to basically allow all these people that you mentioned, from IT person, people that do other stuff around healthcare, to let them also into their environment. So a physician today is a totally, I would say, different physician than the physician 20 years ago, because 20 years ago you had perhaps a couple of drugs, and then you used, I don't know, for a patient the yellow pack, and then it didn't work, and then you used the green pack. Today it's totally different. Today the physician in principle should benefit from something, from an investment that goes into technology, an investment that goes into more information, so that when the patient comes to his office, he has tools which allows him to take the right diagnosis. So, for example, before starting treating and prescribing a product, to really understand, who is the patient in front of me, having the tools to, for example, do a gene sequencing or something like that, to get more information about the patient, to find the right treatment. Because if we do that, then I think we can save a hell of a lot of money for the healthcare system. We can save on bureaucracy, we can save on a lot of things, because we are focused. We know exactly who is there, and the clinician who is, taking the decision can even help with, the tools that will be hopefully one day made available for them, can take, the right decision for this particular patient. And I think there is the let's say, I would say, the clue about, working together, trust, and accepting, sometimes opinion of others. Sometimes, we speak to people, artificial intelligence. I'm not a specialist in artificial intelligence, but I have specialists around me who know really a lot. And I think it is important to listen to these people and trust these people that, they're doing the right thing. If I'm challenging everything, and if I'm not allowing these people to come into my environment, then I think it will be very difficult, because then either I miss the train, or I will not be part of the evolution, and this is not, what we want. Because at the end, I think with all this new technology, with all these new ideas that come up, and the investment that hopefully is done into these fields, that the physician has somehow like a back office of tools that he can go to make sure he takes the right decision for the patient, and also, as mentioned, the one that is most efficacious. We know, for example, in breast cancer, one of the most successful, products in the world that we have developed, is not working for 75% of the women with breast cancer, but for 25% it is, and it is even life-saving. And we can differentiate there, with a biomarker, to choose the patient. Say, this patient is negative, it doesn't work. This patient is positive, it works. But if we would have used that product for the patients that were negative, because we would not have the test, then perhaps at the end of the day, people would have said, well, this drug is not working, so let's forget it. And, and then lots of women perhaps would have died earlier on that are still alive today. So I think it's really very important that the physicians, the clinician, the one who is at the point of contact, has all the backup to really take the right decision in order to treat the patient the best possible way.
What is the scope of precision medicine? Everyone, when we talk about precision medicine, everyone talks about cancer. So aside from cancer, is this the way forward for all disease, just a bit later, or is there a limitation on what kind of disease precision medicine can address and which one perhaps cannot?
Yeah, I mean, for example, of course, cancer has made an incredible development in the last years. And frankly speaking, I think we have gone in the last 20 years from a Fiat 500 to a Ferrari, if we would say how we would treat cancer patients today. But if you take, for example, the example of lung cancer perhaps 20 years ago was seen as perhaps, one cancer only. Today, with all the mutations that we have seen, lung cancer has become 20 different diseases, and you can really focus on some of them. So this know-how is incredible, and I'm sure that because of course cancer has been very much focused in the last 20 years. It's still a focus today, of course, because for many cancers there are not enough solutions. But I'm sure other disease areas will come in where there are biomarkers that will help the physician to take and make the right choice for that particular patient. So it's as I know that, for example, in our research and development programs in our company, we are trying to develop these kind of markers together with the products to make sure that the physician is taking the right choice. And it goes a little bit back to do diagnosis first and prevention before you start the treatment. So if we can start early on with data, with know-how, investment into technology, with all these kind of things, we can do a hell of a job for that person that is the physician, because he's the one that is really affected by all of it. And by all the things that are happening today, I don't think that, every physician can know everything about everything. It's impossible. And this is why, coming back to the first question that you asked me, how can you change this mindset? I think people need to be open, these clinicians, we all need to be open to let other people come in who have the expert knowledge to make sure that they support us in the decision we are going to take.
Thank you. And Nick, are we going to be able to diagnose all diseases early enough before they become a major problem?
Well, of course, the precision medicine is in development. So there's a lot to be seen in the future on further applications in metabolic disorders, rare diseases, and not only oncology. But first of all, I would more consider personalized medicine as a part of personalized health approach. Where you look at patient characteristics, and besides the biomarkers, also the needs and the characteristic, the context of the patients. And if you take, for example, diabetes, the success of the treatment is depending on how effective the interaction with the patient is. Had to adhere to insulin, but also to the lifestyle. It's very much a lifestyle approach. And a lot of our diseases which are responsible for the burden on healthcare systems is lifestyle related: obesity, cardiovascular disorders, mental health disorders, etc. So, and a lot of these diseases don't require a genetic profile. It can be useful in some places, but in general, sort of a preventive approach to the community is already is very beneficial for health in general. So exercise, better diet, we know it all, better sleep, no stress, etc. That's a good bullet in medicine, which we should use anyway, and which is beneficial for all. It's for children, it's without side effects, etc. And then still, we deal a lot still with all kind of disease for which we need a more tailored approach, and maybe a more tailored biomedical approach. So I think also for Serbia I think it would be best to take a broader perspective and see how the different things fit well together. Because in the sort of savings you can do with a more preventive approach, you can invest in maybe a more tailored approach to more complex patients. So you can see the complexity and that everything has to well balanced. And we know that's a challenge. But yeah, if you are on this road, that's wonderful.
Branko, let me quote the paper of yours. It says at one point, beyond the healthcare system benefits, personalized medicine can have a substantial socio-economic impact. Please tell us a bit more about this socio-economic impact and economic opportunities that personalized healthcare and life science in healthcare open up in front of us.
Well, you can start with a simple reduction of hospitalization rates. Then you can have a reduction of adverse effects. So this is both affecting patients, but also generally we can talk about socio-economic effects. It can reduce slack. So basically you can be much more efficient and you don't, and I think Mr. Adriano already talked about this. So you had several iterations and then you made a mistake, then you come back and try to do it again. And basically this approach, this process is allowing you to be much more precise and to have to prescribe treatments which are adequate for particular groups, for particular specific issues which are related to healthcare style, to a number of things that Professor Goldemund already mentioned. Basically, there are several estimates, worldwide estimates, how costly this is. And we are talking about billions, hundreds of billions of costs for healthcare systems because of this inefficient way how patients are treated or because of all other additional costs that may appear because of this wrong approach from the start. So this is where personalized medicine actually can make a major cost savings. And with reduction of this slack, basically you can then have additional resources that you can use for other purposes. So you can basically make your health system even more efficient than it is.
Adriano, I'd like to ask a question about the creation side. So there is huge advancements every day and huge investments in the area. So what should Serbia do to be on the creation and not just the consumption side of this paradigm shift?
Yeah, I think, as I said before, I think Serbia is and I'm really impressed, is on a right path. And from my point of view, it's actually an easy answer. Bringing the stakeholders, together, sitting around the table, define a project, and say, okay, let's not discuss every single, participant's contribution, but let's discuss what we want to achieve as an outcome of this particular project. If you bring these people to the table and you talk on a trusted level together with each other, I'm sure you can make massive steps forward. And as I said, perhaps 20 years ago, there were a couple of, pharmaceutical companies and some, physician groups around the table. But today we have, from pharmaceutical company to IT specialists to, patient organizations, to physicians groups, to governments, that the group has become bigger. And I think this is what will make the difference, to bring these stakeholders together and, focus on one single thing that you want to achieve and really do it, and not getting defocused by other things, by criticism or by things that come from right or left, but to really focus on what you want to do. And perhaps here it sounds a little bit pragmatic, but I usually like easy examples. But imagine, it's like a Formula One car where you have, those people do, I'm sure that, the people that develop the tires, they must have invested hundreds of millions to find the right tire for a Formula One car, as may have those that have built the carrossery, the engine, and so forth. And at the end, you see the driver sitting into the car, driving off and trusting that everything, will stay together so he can really drive at that speed. And to use this metaphor, it's actually the same thing, to bring the driver to the table, to bring the mechanics to bring to the table, and also bring, the technology that they develop to the table, and to make it, one. And I think if this can be done, I think in Serbia, and as I said, in Serbia, you are on a real good track there. I think then, you know, I'm sure over years you will save a lot of money on healthcare costs, on waste, and in the healthcare system, and you will have, you know, physicians that are on the crest of the wave. I mean, that's what you can expect. But of course, it's not a decision that you take on Friday night, and on Monday morning you have a solution. So you really need resilience. So to be resilient, persistent, and get going. But to bring these people at the table, I think that's what will make a difference.
Thank you. Nick, would you have any advice for Serbia how to attract more innovations, more investments into innovations in these life science areas?
Well, we already mentioned some of the ingredients which are success factors. But I think also one of the lessons learned is that the collaboration and the partnerships are really of extreme importance. Because by collaboration and having a network, you can make yourself stronger, and you can capitalize on things you don't have yourself, or maybe not fully yourself, but can be provided by others. So thinking about the quite a unique position of Serbia in relation to Russia, in relation to China, a lot of other countries, I think this is also something to benefit from, because if you are the pivot wheel in the center to make things work, and you don't have to have everything yourself or do yourself, but if you can work it together, you can make the initiative or be a vital element in the collaboration, looking to industry, to startups, etc., connecting markets. That's another advantage, I think, to carefully look at. Yeah, this in order to make it work, this human factor is extreme of importance. So in my early days in this innovation ecosystem, there was a phrase used like, okay, you build and it will come. And all around the globe, you see a lot of startup clusters with nice, fancy buildings and facilities. But yeah, it's not guaranteed to success. It's very much depending on how the system works as an organism. So I think and that also creates a much more value and advantage also with limited resources. So I think it's more smartly looking at how it might work, how you can capitalize on your infrastructure, on your people, on your partnerships. And maybe last thing so companies like Roche, medtech companies, they also look into this sort of environment which works very fluently, very dynamic. So in interaction with people, okay, the clinical need, clinical expertise, access to people's needs, etc. The data, how can we extract evidence, or nowadays real-world data, for example. So it really comes more to this than the nice flashy folders with the nice buildings and the happy, shiny people. So I think that knowing a little bit the Serbian people, they're quite straightforward, quite concrete, business-wise. So I think it should go well.
Thank you very much. Branko, as a university professor, I have to ask you, what's the role of universities in all of this, and how can universities contribute?
Well, they are part of this ecosystem. So both academia and healthcare professionals, data mining companies, they're all part of this ecosystem. And I think it's really important to have a common understanding of what personalized medicine is. And I'm already sure that there are a number of extremely good professors and in academia that are well aware of it, and whether Serbia is going to establish a specific program, like they're already present in some other countries, like in the Netherlands, in the UK, that are dedicated just for this particular field of study. This is one potential area of research and development for Serbian academicians. So this is something that is really interesting, not only for healthcare professionals, but also for economists, for those who are thinking about regulatory framework, for IT people who are thinking about how to establish and how to share information. But there are also a number of other issues that we actually didn't explore into details, like ethical issues or some specific regulatory impediments that may occur on this path. So yes, I think that this is interesting field of study for Serbian academia, and there are already research papers in this area that are published in some journals.
And how would you assess the current situation? Is there a full cooperation between the stakeholders, or where are we now?
Well, it's a long path ahead. You know, as I mentioned, this common understanding of what personalized medicine is, what are the steps, what's the way how we can integrate this. This building blocks is important thing, because then everybody can in this stakeholder space can find its place and understand better its role and exchange information. And as I mentioned, there are a lot of AI people who will appear, who should also be aware of this potential opportunity to understand what is personalized medicine, how to use this big data, and how to process these data. So there are a lot of issues that occur and that are potential for research.
Okay, we have 5 more minutes, so I'd like to spend them to ask each one of you, what would be your message to our audience, our business people on Kopaonik Business Forum in the audience, thinking, how can I get engaged? What can I do? What could companies and what can business community in Serbia do to be part of this paradigm shift of life science and precision medicine in healthcare, and maybe not just in healthcare, maybe in other areas, in, I don't know, food or agriculture or something like that. So, Adriano, please.
Yeah, I'll be very brief. I think the healthcare systems are complex, and I don't think that one stakeholder can solve it alone. So for me, the key ingredient is that we are all in this together. We need to trust each other. We need to work on common projects, and we need to make it together for the benefits of the patients. I don't see that there will be one single solution with one single provider who can solve the things. I think we all need to do it together, because, as I said, everything has become so complex that we do not have the expertise in all the fields. And if we bring the expertise to the table, then we can bring solutions, for a better patient care.
Thank you. Nick?
Well, I think, so a lot of the things we discuss is, I think, about interfaces. How do you create the environment where the creativity, the potential of people, businesses can meet and doing new things or different things. So thinking about how can we create these interfaces, these environments, these settings, in order to make these innovations and transitions. So what we have learned is that typically localities, settings like a city, or it might be a health community center or hospital, but how could it work for a specific theme like, well, it could be precision medicine focusing on oncology, but it might also be more focusing on social lifestyle related issues. And this can be different from community to community, so it might be different in Belgrade compared to Novi Sad or some in the rural areas. And how this could work if you think about improvement of healthcare, using the expertise from the academic research and development side, from a clinical side, from a healthcare systems perspective. So this, I think, is a very practical approach. And this so-called living labs approach, I think there is very interesting evidence that this is a very good approach to improve healthcare, to make transitions, to connect the different stakeholders. And there are existing networks of regions across Europe and Eastern Europe who want to collaborate. For example, Romania, the Cluj, Bucharest, like I said, Poland, and Slovakia. So I think there's a lot to learn about and to think how can we do this in Serbia.
Thank you. Branko, what did you say?
Well, when we were preparing this paper, one of the articles that we were using, the title was "Patients Will See You Now." So instead of "Doctor will see you now," "Patient will see you now." So basically, it's amazing how the space of development is so fast. And probably some things will occur in the 15 years or now, the system will be completely changed. So what I would like to see here is the awareness of this dramatic change that will occur, to be ready and to not only limit this to healthcare workers, because this ecosystem, this various stakeholders that we should engage, it's so vast. There are a number of them, and they should all find their place and fit actually into this new system as soon as possible. What's also important is to have some kind of strategic view on this. And what would be really good is to have some kind, actually our Ministry of Health is providing us with policy documents which are of decent quality. It's probably one among the best ministries that we have as Ministry of Health in terms of quality of these papers. And maybe it would be really good to start thinking about a document that will start thinking about this personalized medicine, not immediately, but like 5-10 years from now, where we would like to be. What would be our aim and how to reach this goal. So this is a short message basically to decision makers.
Okay, thank you. Thank you very much. I can assure you that the government of Serbia is looking at life sciences and healthcare and all the transformation and paradigm shift, as you said, as a huge priority and as a huge opportunity for a country like Serbia to really be on the creation side and to join the R&D efforts in so many areas, from AI to genetics to biology to molecular to whatever, and all those things are happening at the same time, and it's hugely exciting. And I would really like to use this opportunity to ask my community, tech, IT community, to look into the healthcare a bit more carefully and to try to join the wagon, to join the train, because we see this as something that is really very important from both business perspective and also healthcare perspective. And as you said, Branko, one of the main goals at this point is to raise awareness. And I really hope that we did our small part in raising awareness here with God knows how many decision makers in the online audience today. But this is hugely important topic, and I really hope that we helped to make it a little bit more clear, and that we made the future a little bit more clear, and the importance of this topic in the business minds of the business community in Serbia and abroad, if they're looking this. So I'd like to thank you all for being on this panel. It was my personal great pleasure talking with you. I could do this for hours more, but our time is up, and thank you very much.
Thank you.